chunks. So the brain-gut axis dysfunction, this is where I find it's very interesting, but most of us don't really look at the brain-to-gut axis dysfunction. We probably understand a lot about how the gut impacts the brain, but let's look at how the brain function or dysfunction impacts the gut. So the neurological causes of brain-gut axis dysfunction is when you have traumatic brain injury or a neurodevelopmental disorder like autism, right? Or neurodegeneration like Parkinson's or Alzheimer's or vascular dementia. So those are the conditions that can really impact your brain function. Now, when you have these neurological dysfunction, what's going to happen is that you will have a decrease in your vagal activity. This is the vagus nerve. So you're going to decrease signal communication from the brain is going to, there's less of it going to the gut, which then will decrease your parasympathetic activity, which then will lead to decreased blood flow to the gut, right? Decrease communication to the gallbladder, to the pancreas, to the liver, to produce enzymes, to produce hormones that regulate our digestive function. You also, when you have a decrease in vagal activity, you also have decrease in motility. So that will lead to bloating, indigestion. So as people get older, I was going to say our parents, I have a lot of older patients that come to me with loss of appetite, loss of interest, they're just not eating. So those, and then they're constipated. That's because as they get older, right? Now, what I didn't mention is that these the top three, the traumatic brain injury, neurodegenerative, and neurodevelopmental disorder, the fourth cause of decrease in vagal activity or decrease in brain function is going to be environmental toxins. So imagine lead in the brain, mercury in the brain, right? We've been using mercury fillings in our teeth fillings since I think like the 40s up until the 2000s. We then learned that mercury is actually toxic. So now we're removing them, but in the process of removing them, we're exposing ourselves to more mercury. And then as a profession, dental hygienists and dentists, they get a lot of exposure to mercury. So those are other things that I forgot to put into this slide, but those things will decrease your motility, so causing constipation, bloating, and dysbiosis. Dysbiosis is too much bad bacteria growing compared to good bacteria. So then this decrease of vagal activity will also decrease activation of your intestinal smooth muscles. So the smooth muscles in the gut is responsible for the peristalsis motion that push food forward in the small intestine to eventually cause you to expel the waste. Now, when you have these decreased activities, right, let's look at what kind of health impact that will result from that. So when you have poor brain health from neurodegeneration, neuroinflammation, toxicity, right, or gut dysfunction, you're going to have poor memory, inability to find words, difficulty learning, brain fog, fatigue. Now, these are just some of the ways that these symptoms manifest, right? But when that happens, you have a decrease of brain activation of the pontine vagal centers. That's just another fancy way of naming the part of the brain stem where the vagus nerve connect to the brain. So when you have that, again, look at the impaired, so the decrease of the smooth muscle constriction or contraction, right, impairs gut motility. So you're not going to be able to eliminate waste so well. And then when you can't eliminate waste, all the toxins will backflow into the liver, increasing your hepatic toxic load. And that's going to lead to toxins backflowing into your lymphatic system. And then now your lymphatic system can't remove waste from your organs and tissues. And then so all the waste backflow into the cells. So now you have cells that are filled with waste products causing cellular inflammation, oxidative stress, leading to chronic diseases that we know today. So this decrease in activation of the enteric nervous system also will decrease the ileocecal valve tone. So the ileocecal valve is the valve that opens from your small intestine to your large intestine. This valve is really important in separating the small intestine from the colon so that the bacteria in the colon doesn't grow into the small intestine. So now that you have a decreased tone, you now have a high risk of bacteria and waste products literally backing up into your small intestine where there shouldn't be any stool, there shouldn't be a lot of bacteria there, which then lead to a condition called small intestinal bacterial overgrowth, which usually is accompanied by small intestinal fungal overgrowth. Those are things that really cause a lot of dysfunction in the gut with bloating, abdominal pain, excessive gas, just lots of inflammation that leads to fibromyalgia symptoms, autoimmune disease, like severe brain fog, and chronic fatigue, right? And then also, when you have decreased signal to the enteric nervous system, your gallbladder doesn't contract, leading to gallstone formation because you're not releasing the bile from the gallbladder, and then cholesterol also gets stuck in there, and over time, cholesterol becomes sludge, and then it becomes stones. And then in the stomach and the pancreas and the gallbladder, you decrease stomach acid production in the stomach, so you can't digest protein. Excess protein is going to go to the colon, feeding proteobacteria, which then can overgrow and cause dysbiosis. Decrease in pancreatic enzymes cause you to have issues with digesting starches or carbohydrates like fiber, starchy and non-starchy carbs, and then basically you're not going to be able to extract nutrients, right? And then decrease in bile production, which then affect the ability to digest fat. So you're seeing the picture here that when your brain is low functioning from brain injury, so most of us, in younger people, I should say, we don't deal with neurodegeneration yet, but we deal with a lot of micro injuries to the brain. So when we're little, most of us have experienced dropping our kids from the bed to the floor, or they fall off, or we fall off, or we ride the bike. I mean, there's a lot of falls that we've encountered in our lifetime. That's what causes us to have these micro brain injuries that can over time accumulate, especially combined with environmental toxins, like I mentioned. That would be what causes the brain to have problems, which then causes the gut to have the last thing here is reduced blood flow to the intestine. Again, when your parasympathetic system is not turned on, right, the blood flow is going to be shunted to the muscles in your limbs, in your legs, in your arms, because it turns on the sympathetic system. When the parasympathetic system is off, the sympathetic system has to be on. So this is where you're going to have intestinal permeability, which is leaky gut, leading to a lot of chronic inflammation. Now you can see that if all these things happening in the gut, it will feed back into the brain, and now you have a vicious cycle of brain dysfunction causing gut dysfunction, and gut dysfunction causing brain dysfunction. And then over time, you're going to deteriorate. I shouldn't say you, the person who deals with this would deteriorate. And that's why we have such a major problem in our society today, just from lifestyle, just from not taking care of our gut properly. So I kind of put this together for you, but I'm not going to go over this because I kind of just went over all of this over in this slide. But I want you to have this so you can go over this on your own when you review the slides. Okay? And I want to talk briefly about brain injuries. So traumatic brain injuries, especially in kids, young people, so after a car accident, whiplash, right? Playing football, playing sport, getting hit on the head with something, anything, right? That actually will cause, look at these pathways. It causes so much dysfunction, brain inflammation, right? Causes the breakdown of your blood-brain barrier, now making you more sensitive or vulnerable to hidden infections and hidden toxicities, right? And then it impairs your immune system, leading to leaky gut, disruption of your vagal motor tone activity. So then you have less function, mostly to the gut, but also to your ability to heal. So when there is traumatic brain injury, the biggest thing that someone needs to do is to sleep, right? A while ago, like 10, 20 years ago, the treatment for brain injury used to be that they would keep you awake and make sure you don't sleep so that you don't pass out, or they were fearful that if you go to sleep, you won't wake up, etc. But what we find now is the opposite, is that we actually have to sleep so the brain can rest, right? And eating a healthy diet so that you get what you need to repair the brain, but also removing any inflammatory foods so that you don't cause dysfunction in the gut, which then worsen the brain function, where you can't heal the brain. So I want to mention this because I actually had a few patients that had traumatic brain injury from a car accident that really started to deteriorate, loss of function. But when I started to hydrate her, making sure she sleep, repair her gut microbiome, she actually recovered from all her disability. She was actually on disability after 6 months after the car accident. So I mentioned this so that you know, if it ever happens to you, you now know how to manage your brain injury. And I will see you in the next video.